largest organ in the body, and the health of your body and your nutrition status is often reflected in your skin. Hi, I'm Dr. Elizabeth Boham, and today we're going to review the nutrition-focused physical exam. There's so much you can learn about your patient's health and nutritional status through the skin exam. You may determine through the skin exam that your patient needs to go on a low glycemic impact diet, or you may determine that you need to supplement their diet with extra vitamin A or essential fatty acids. You may also determine that you want to refer your patient to a nutritionist for further assessment and intervention. The skin is made up of the epidermis and the dermis. The epidermis is the outer layer of the skin, and it's a very important protective barrier. The dermis, right under the epidermis, is made up of connective tissue, fat, lymph, blood, sebaceous glands, and hair follicles. The skin also includes your hair and your nails. The skin is a dynamic organ. Come with me so we can discover more about your patient's nutritional status through the skin. The most important piece of equipment that you need for your skin exam is your eyes. So it's important that you have proper lighting in your room and you're fully alert. Your sense of touch is also really important, so you'll be using your fingers a lot during your skin exam. You may also need gloves at some point during your skin exam. You'll want to have a ruler handy so you can assess a lesion and document it, and a camera so you can document lesions and keep them in the patient's chart for further reference. Magnification is also very helpful. You may want a magnifying glass or an episcope so you can see a lesion close up. To do the potassium hydroxide test to look for fungus, you're going to want to have 2 slides so you can scrape a lesion and some KOH so you can look for fungus. We also want to review proper draping. It's very important that your patient feel really comfortable during the skin exam, because when you're doing a comprehensive skin exam, you're going to look at every aspect of the skin. For the purpose of this video, we're going to keep certain sensitive areas covered. But when you do your skin exam in your office, you want to properly drape your patient so they feel comfortable when you do their full skin exam. When you're doing your skin exam, you want your patient to be fully draped so they feel very comfortable while you have access to look at all aspects of their skin. When you're doing the skin exam, you're often doing it when you're doing the full exam on the patient. So I have the patient often starting sitting. At times you'll have the patient laying down, but it's important you adjust the drapes so you can look at the upper extremities and the chest while making the patient feel comfortable. When you're looking at their legs, you also carefully adjust the drapes so they feel comfortable. I often have my patients stand, so I have full access to their back and their legs in the back that we need to look at as well, and often have them turn and look at their full front. It's important that you have your patient fully draped so they feel comfortable while you have access to all aspects of their skin. Your nutrition-focused skin exam starts the moment you walk in and see your patient and look at them. There's a lot that you can gather just from looking at your patient's skin. In addition, when you shake their hand and you feel the texture of their skin, feel the temperature of their skin, you look at the color of their skin, look for hydration, that tells you a lot about their nutritional status. If you see dry skin, you're going to start to think about, is there an omega-3 deficiency? Is there a vitamin A deficiency or a zinc deficiency? And then that brings you back to the matrix and you wonder, is there something that's preventing malabsorption of these nutrients? How is their assimilation? Or do they have an increased demand for these nutrients? When you feel the back of their arm, if you feel any follicular hyperkeratosis, you're also thinking about vitamin A as well. And you're wondering, is there any genetic polymorphisms that's changing the way that their body is converting their beta-carotene into vitamin A? If you see a lot of acne on their skin, maybe on their face or their back, you're wondering, is there some toxins in their system? Or is there some dysbiosis that's impacting the quality of their skin? If you see acanthosis nigricans, it's often seen in the intertriginous areas of the body, in the neck, in the groin, in the armpit. Some darkening of the skin. You're going to wonder about, is there insulin resistance? What's their waist to hip ratio? Are there other signs of insulin resistance going on? What is their hair pattern? Is the patient lost hair, if it's a woman, on the top of their head, but they've got some hair growth on their chin or on their abdomen? If you see some lesions that are not healing, you're wondering, what's their nutrition status like? What's their protein intake? And what can I do to optimize their nutritional status? There's so many clues that you can gather from the nutrition-focused physical exam. If you see petechiae or easy bruising, you're wondering about vitamin C and vitamin K. There's another important test we can do called the Hess test that can tell us more about vitamin C. The Hess test is a way to look for capillary fragility. When you see increased capillary fragility, it may be a sign of vitamin C deficiency. So when you're doing a Hess test, you inflate your blood pressure cuff to halfway between their systolic and diastolic blood pressure. So Leslie's blood pressure today was 110/70. So I'm going to inflate the blood pressure cuff about 90 millimeters of mercury. And then we're going to hold it there for 3 to 5 minutes. After 3 to 5 minutes, you're going to get your episcope or magnifying glass. You're going to go 10 centimeters below the antecubital fossa and make a 1-inch diameter. This episcope is about 1 inch in diameter. You're going to then look for broken capillaries and count them. If you see more than 10, that can be a sign that this patient is low in vitamin C. Hi Leslie, I'm Dr. Boham. How are you?
Morning, great. Thanks.
Welcome. Today we're going to do a skin exam. So I'm going to look at all aspects of your skin. So let me just look at your hands here. Do you have any concerns about your skin?
No.
No. Have you noticed any roughness or dryness?
At times, but right now it's seeming pretty good. Pretty good.
Okay, good. Have you noticed any changes in any moles or freckles on your skin?
My moles seem to be getting darker, but not dramatically.
Okay. I'm just gonna look at your face. Look at your skin on your face. Good. Come lay down for me. Do you take any sort of supplements, any essential fats, any oils, any vitamins?
I do.
Yeah, what are you taking these days?
I take fish oil and D
Okay.
and some methylated B vitamins.
Great. I think that's why your skin's looking so nice, huh?
I think so.
Yeah. Okay, good. Good, come stand up for me. And I'm just going to look at your back. Great. And I'm just going to look at your front. Good. And come sit down. This is a magnifying glass called an episcope, so I'm just going to look at one of the moles closer up. Good. Looks good. Thank you for coming in today.
Thank you.
Have a good day.
Thanks.